Hi, I'm Dr. Priya Matthew from MVP Family Dental, and I'm here to answer some questions about single tooth implants. A single tooth implant is a way to replace a space in your mouth. If you're missing a tooth, you can get a single tooth implant to replace that tooth. A single tooth implant differs from other types of replacements, such as, say, a partial denture, because it is permanent and it is fixed. So basically, once it's put in there, it stays in there. It doesn't come out at night. It stays there. So the process of getting a single tooth implant from the consult to the placement starts with an evaluation of the area that needs to be replaced by the implant. So we basically take a couple of scans to see how the area looks and if it is a good candidate for an implant placement. And then once we determine that, we use those scans to make what we call a stent. The stent is like a guide, and then you make your appointment for the placement of the implant. I have the guide made. We use the guide to place the implant, and then that's it. And then you go home and you wait about 3 months for the implant to heal and do its thing with your bone and be permanently, basically to adhere to your bone. And then once it does that, we can take a scan and get your crown made for that implant tooth. Sometimes you need a bone graft for a single tooth implant. It all depends. If you've been missing the tooth for a long time, a lot of times people will need a bone graft, and that just means adding bone to that area. If it was newly missing and there's enough bone in the area, then you don't need a bone graft. A single tooth implant compares to a bridge or denture because we're only touching that one area where there's no tooth. With a bridge, you have to prepare the two teeth on either side of the missing tooth. So if those teeth don't really need to be crowned, then you're messing with them and you don't really need to. Whereas a partial denture comes out and in, it would replace that little area, that one spot where your tooth is missing, but you would have to take it out at nighttime. It's not going to be as comfortable as an implant. So patients should expect some time for the implant to heal, but no downtime or no real sensitivity or pain after it's placed. Usually the patient the next day is totally fine, has no pain with the implant site, and they're numb for the implant placement. It's really less invasive than, say, a tooth extraction, taking out a tooth, because it's much more simple. It just goes in one way and you're done. So the healing is pretty easy. Patients can find a qualified tooth implant dentist by calling MVP Family Dental. The benefits for single tooth replacement with a dental implant are that it's a lot easier than having a partial. Instead of a bridge where you have to prepare the teeth next to that missing spot, you basically are putting an artificial tooth root in where you had your tooth, your natural tooth. So it's really like the best option for a missing tooth because it literally just goes in the spot that you're missing a tooth. A single tooth implant can run between $2,500 for the placement to $2,500 for the crown. So it's about $5,000 for both parts. Keep in mind there's 3 months in between, but it's about that much. There are not significant differences between the cost of an implant versus other options for what you get. Basically, a bridge may be comparable in price to an implant, a single implant, because you are doing crowns on 2 teeth and then the bridge, which is the tooth in between, so it's kind of equivalent to 3 crowns. A partial may be a little less expensive, but in the long run, it's not going to last as long. You're going to have to get a replacement eventually, and that cost would probably equal to getting the implant, the first time around. So, especially, and also to add the inconvenience of the partial compared to implant. You can find out if you're a good candidate for a single tooth implant by calling us at MVP Family Dental. It's 215-887-7171. You can come in for a free consult. We'll take a look and let you know if you're a good candidate.